doctor. We're here today doing some Sculptra and trimming the eyelids. Kim, thank you for letting us share your video today. So we are all set with everything. Rita has everything set up for us. Ashley, I'm curious, can you share with us what was it that inspired you to have a treatment done?
My mom actually had it done about this time last year, and her results were amazing. And I figure I'm like her little child, so I'm gonna look like her one day. So it doesn't get better with age, obviously. So why not now?
Well, you're in the right place, and you're being preventative, right? Patients today, they don't want to wait for advanced aging changes. So we're starting with the Sculptra. Now, Sculptra is a superior collagen stimulator. So what we do, why don't you take a look in the mirror. For under the eyes, make a big smile for me, big smile. See, that's our model. That's what looks good. Now, relax as best you can. So we're going to build the volume in through here. Now, Sculptra is a gradual collagen stimulator. So what happens is, you see a result immediately, and then it goes away. And then in about 3 to 6 weeks, you'll see some improvement. But even at 2 and 4 months, you'll see a little more improvement yet. So we're going to focus right in through this area with the Sculptra. I may do just a little touch here, but mostly I'm going to focus up on top. Any questions about our goals for today?
No.
I'm going to hold this for you. So Ashley is another A+ student looking for extra credit. She already looks great. And we're staying ahead. She has many active years ahead of her. I like, for the physicians and students that are watching, I like to use the HIPAA cleanse and the alcohol for cleaning the skin. It's very rare that someone gets an infection from a filler, but still we do that cleansing. So this is the HIPAA cleanse. And then afterwards we're going to do the single stitch, that little one stitch, just pinching some of that extra skin because we get that crepiness of skin under the eyes. And we try to prevent the full lower blepharoplasty because when you remove fatty pockets or remove muscle and skin, you don't want to hollow the eyes out. That is something that happens as we get older. It's very normal. We're going to hollow in our eyes. So we want to prevent that. We just remove the necessary skin. We leave the muscle, we leave the fat, and we're building the volume with the Sculptra. So you feel a little buzz, then pinch on 3, 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad.
Not too bad.
And then you feel pinch on 3, 1, 2, 3, pinch. A little bit there where we're going to be doing the skin removal. Buzz and pinch on 3, 1, 2, 3, pinch. Fillers are the future. They look great. They look natural. We don't overdo it when you have the right artist. I prefer to use Sculptra right under the eyes because it is a superior collagen stimulator. It does work well with permanent fillers as well. That's a very popular choice. Do you feel a little pinch there? Not too bad?
Yeah, barely.
So we make the insertion point because the cannula is a soft tip cannula. So we just make that little insertion point through the dermis. Feel a little bit of a pinch there.
Mm-hmm.
And Rita has everything set up perfectly for us, makes it very easy.
Good job, Rita.
So I like to mix the product immediately before I'm going to inject it, so it's just a little air bubble that I bring through the product. Because the Sculptra can settle, so this way you have the most uniform distribution of the product through the diluent. Twist technique to set the cannula in the right position. So a little pressure, a little pinch. Shiver technique for a very small amount of filler over a large area. Do you feel small, medium, big pinch there, Ashley?
Small.
I'm not in a hurry. Now there's some numbing medicine with the Sculptra, so as we continue, the more we inject, the less she's going to feel. Everything's looking good. Perfect. How about now? Small, medium, big pinch, not too bad?
Not too bad.
She's tough. How long have you been thinking about having something done for now?
Probably like a year and a half. So that's when I started noticing everything not going the right direction.
What was holding you back from doing a treatment?
I think just trying to find the right place, right doctor, trust and everything.
Absolutely. Well, we are honored to be a part of the process with you, and we will do it the right way.
I appreciate it.
You can always come back another day and do more, but usually one vial of Sculptra makes a significant difference in this area. Some people do second or third treatment, but you always start with one and see how you respond. Pressure pinch, pressure pinch. You feel a little pressure pinch there? Sorry, pinching, okay. Now that we've set the cannula, a little bit of numbing medicine there. Everything's looking good. So I go back and forth for the physicians and students that are watching. You got her further? I always go back and forth from side to side, so that way you keep the amount that you're doing pretty equal and symmetrical.
How you doing, Ashley?
Good.
Good.
We like equal and symmetrical.
So Rita, why don't you come around and you can come in a little bit closer so you can see. So I find that little insertion point. Twist, twist, twist to set the cannula. And this is a subcutaneous injection. Perfect. You feel a little pressure pinch here, or not as much this time?
Oh, barely anything.
Yeah, now that she's had some of the numbing medicine, she'll feel less, and that's the benefit of putting lidocaine inside of the product. We prepare Sculptra. We always have Sculptra ready. We mix it ahead of time, and we use so much of it that we're always remixing Sculptra pretty much every day. Everything's looking good. For the physicians and students that are watching, if the patient feels lightheaded or queasy during the injection, you lay them flat. That's called the vasovagal response. And that means the blood is just flowing to the legs and away from the brain. And then you get that feeling of lightheadedness. And if you just lay them down, it goes away very quickly. But most patients don't feel that, but if they do, that's the right answer. That's the right thing that needs to be done. Everything is looking good. Yes, did you have a question? Go ahead. Okay, one or two is fine. Just let me know about her vitals. Thank you. Pressure pinch. You feel a little bit less this time?
Yeah, nothing.
Thank goodness for
I
lidocaine.
like it.
Perfect. She was just in here, Claudia. You want to take that to her? You can take that to you, Cindy. Very good. So we just go from side to side, right? If we were just doing the Sculptra alone, Ashley would pass the grocery store test today, right? You walk into the grocery, no one does a double take, but we're going to be trying a little bit of the eyelid skin, so she will have some numbing, some swelling from that.
No grocery store visits today.
That's right. You do Instacart instead.
Yep.
Thank goodness for delivery. My goodness. How our world has changed. There's no restrictions with the vaccine. We recommend all of our patients get the vaccine. There's been only 3 reports of people that had swelling after having fillers, but those all resolved with antihistamine, steroid, or no treatment at all. And so it's not been a problem in my practice. So we are encouraging patients to get the vaccine. Everything's looking good.
Dr. Rich, how long do the fillers last?
So we have permanent fillers. Sculptra lasts about 2 to 4 years, and so because it's a superior collagen stimulator, I like to use it under the eyes. It works very well with the other fillers. So my job is that you know your options, and so that is a popular choice to use Sculptra under the eyes, and then of course Bellafill. I can use Bellafill or Sculptra all throughout the entire face. So the duration of the filler depends on what you choose, but I do like to use the collagen stimulating effect of Sculptra, which lasts about 2 to 4 years. That's one of my, I think it's the best result under the eyes. And people will usually do 1 session, maybe 2 or 3. It just depends on how the body responds, and depends on the expectation that you have.
A viewer is asking, I have rosacea. Do you think it's a problem for these procedures?
Rosacea is no problem at all for what we do. Obviously, we recommend our patients follow with the dermatologist. Little pinch here, little pinch. So rosacea, a lot of my patients have it. They do just fine, and you can still do the treatments even if you do have rosacea. That's a very good question. Everything's looking good. So even if I don't inject anything at all and I just pass the cannula, you'll have some swelling from that. So she'll have a little bit of swelling from this, but that obviously settles and goes away. And then over about 3 to 6 weeks, she'll start to see the result with the Sculptra. And even at 2 months, 4 months, and 6 months, you see continued improvement. Can you take that one up for me, please? Very good. A little bit more to go, then we're done. And if you're, make sure you're following so that you get alerts when we do video. We will be rebroadcasting when we do her video in just a little bit. Perfect.
Roger saying you're a beautiful lady.
And she is. She absolutely is.
Mm-hmm.
And she's such a beautiful person inside and out. She's such a nice person. But don't make her angry. But that's true for all of us, right? I mean, we can be nice, but listen, don't push it for anyone. We're always human. Pressure pinch.
Ask my volleyball girls how nice I am.
Oh, that's right. You got to be tough. How old are the volleyball girls you work with?
17.
Oh my, those are the funnest ages, right?
Yes.
No drama at all, right?
Rarely. Not
Oh,
on this
okay.
team
Not
right
on
now,
this team.
so we're good.
Not with Coach Ashley.
No, we don't do drama.
Don't do drama. But sometimes it just creeps in, you know, you just can't help it.
Yeah, 12 females, it's bound to creep in.
There you go, that's okay.
Dr. Rich, a viewer has a question.
Yes.
What happens to the Sculptra after 2 years? Does it dissolve?
Well, the Sculptra goes away and turns into lactic acid, which is already found in our body. It leaves behind your body's own collagen. Now, after 2 years, the collagen that your body creates, it's there, but the body keeps aging. So, some people will say, does the things? Some people say, well, if the filler's there and it goes away, is it going to sag things out? The answer is no. Think of it this way. If somebody does no treatment for 5 or 10 or 20 years, and we already know the outcome of that, right? We know what they're going to look like. We don't like it. If you have the Sculptra or filler or some other treatment, it's going to give you a better baseline and foundation. So you're always better off to do the treatment than if you had not, when it's done correctly. Everything's looking good. Perfect. There's no restrictions after Sculptra. When we do the 1 stitch that we'll be doing, you just stay shiny, that's the goal. But you can still resume physical activities. You just have to listen to your body. Okay, so tiny bit of swelling. I'm going to show Ashley what we've done so far. So can you see how it builds up the cheeks? So a little bit of swelling. That's gonna settle, the collagen's gonna build. How does it look so far?
Much better.
Yep, so I like the progress, the trend that we're on is good. Now we're gonna take a little bit of the skin, so we're done for now. Thank you all for watching. We'll have more videos soon. We're gonna take a little bit of the skin and do the one stitch. We're on a mission to stop bad plastic surgery. We're here to do things the right way. We'll see you in the next video. Okay, very good. You wanna use the restroom before we start going? It's taking about